Hi, I'm Dr. Jacob Oran, and I'm here today to talk about preparing for your colonoscopy. So first steps is doing the colon preparation to prepare the bowels for the scope, and we're going to talk about the Miralax bowel prep. This entails a couple of things. First things first is to gather our supplies. We've got our Dulcolax tablets, our bottle of Miralax or an equivalent generic is fine, and then we need our liquids, and so we can either have Gatorade or Propel or Powerade or whichever electrolyte solution you'd like to use. And so really the bowel prep is going to start 2 days before. 2 days before, I want you to eat light, have a light dinner, don't eat at the buffet, and that's it. Then the work begins on the day before the colonoscopy. And so 1 day before your procedure, only liquids. And we say clear liquids. And so this is going to entail several things: broth, jello, you can have coffee, water, and then of course your electrolyte solutions for the bowel prep itself. And then so later in the day, on the day before your colonoscopy, around 2 p.m., we're going to have you start with the Dulcolax tablets. You're going to take 4 or 5 milligram tablets with your electrolyte solution. Typically recommend that you do this in a safe place, not at work. And then you're just going to sit and wait. And then at 6 p.m., that's when the process really begins. That's when you're going to use your Miralax or equivalent, and you're going to mix 1 cap full with your electrolyte solution. Again, Gatorade, Propel, Powerade, whichever you prefer. And you're going to take a glass every 10 to 15 minutes. If you're feeling full, take a break. Otherwise, continue to take the 1 cap of Miralax mixed with 8 ounces of the electrolyte solution until your stools are clear. By clear, we mean there's no particulate, they're not brown, it's typically a clear yellow. You should be able to see the bottom of the toilet. If there's any trouble, you're not alone. You just need to call your surgeon, myself or Dr. Albin or Dr. Morse, and we'll talk you through it. Sometimes we have to adjust on the fly, and that's okay. We usually say call before 9 or 10 p.m. because we don't want you to do the prep all night, and we also want to get some sleep so we're prepared to do your scope the next day. Nothing after midnight. You can have some water up until about 4 hours before the procedure, especially if there's some medications that you need to take. As far as the medications, make sure they were previously approved and take those with a sip of water or your electrolyte solution. Also, very importantly, you must have a driver to take you home. So make sure you have that arranged as well. No blood thinners, as was discussed during your appointment. And then the day of the procedure, this is the easy part. You just have to show up. Once you're here, you're gonna get an IV placed, and then our anesthesia colleagues will be there as well as our nursing staff, and we're gonna take good care of you. At this point, just relax. You're in good hands.